Okay, one more word about calcium before we move on. We need to talk about the really common symptoms that your patients are going to come in to see you with that are big clues that they're probably in trouble with their calcium status. And the first one, an obvious one, muscle cramps or restless legs. Either one of those can be lack of good calcium in the diet or missing good fats or vitamin D or low stomach acid to absorb the calcium. Any of those things can be a contributor to muscle cramps or restless legs. So that's the first thing you're looking out for to give you a clue of low calcium status. Another one that we don't think about as much is itching skin. Chronic itching skin so many times is because of not getting enough calcium or missing the essential cofactor nutrients to use calcium and get it into the skin so you're not itching all the time. And then another one that I love because it's such an accurate indicator of calcium problems is cold sores. You see this all the time here in Florida where people overdo it out in the sun. They get sunburned, and that overexposure to sun depletes their calcium tissue reserves. And what that does is allows the herpes virus to express itself as a cold sore. So yes, it's a virus that's causing the cold sore, but underlying it, it's low calcium that's letting that virus pop out as a cold sore. So all this is going back again to calcium is so important to keep viruses in check, to keep bacteria in check. You've got to have abundant levels of it in the body. So restless legs, muscle cramps, itching skin, cold sores, those are some of the big symptoms that often are calcium problems. Remember also the calcium cuff test. So easy, so effective. Just get a blood pressure cuff. Don't put it around the arm, put it around the calf muscle and start squeezing. And if the patient starts getting pain or gets uncomfortable, gets a cramp before you reach the 200 mark, they're either not getting enough calcium or they're missing calcium cofactors in the body. So you're thinking calcium lactate, Cataplex F, things like that is your primary tools if they fail that test, if they cramp before 200. Remember also the vitamin D blood testing. You can get it very inexpensively through LabCorp, but if your patient's vitamin D levels are too low, they're not going to pick up the calcium from the gut and get it into the bloodstream and the tissue. So vitamin D testing, very important to make sure your patient's immune system is going to be strong for the cold and flu season. So that's enough about calcium for now. Let's talk about the next immune essential, and that is the vitamin C complex. Now, whenever I talk about vitamin C, we always have to clarify that we're not just talking about ascorbic acid. So ascorbic acid is the antioxidant shell that protects the rest of the vitamin C complex when you find it in food. But if you go to the health food store or the supermarket and you see any of these vitamin C supplements and you look on the label, 9 times out of 10, all it's going to say is ascorbic acid. 500 milligrams of ascorbic acid, 1,000 milligrams of ascorbic acid, and that's just one piece of the vitamin C complex, and it's a very incomplete way to try to do vitamin C. Vitamin C, whenever you find it in nature, in food, is always going to have a whole lot of other nutritional cofactors that go with it. One of the most important cofactors with vitamin C are bioflavonoids. So bioflavonoids are the part of the vitamin C complex that protect your blood vessels, that protect your cardiovascular system, that keep you from bruising too easily. So one of the biggest, most accurate indicators that you've got problems with vitamin C is if you wake up in the morning and you see a lot of bruises on your arm or your leg and you don't know how you got them, think vitamin C and bioflavonoids, and you can only correct that problem with food. You can't correct that with just ascorbic acid. Another real common one is you brush your teeth and you've got pink toothbrush, blood on the toothbrush, or gingivitis, irritated, weak gums. Think vitamin C, bioflavonoids, those connective tissue healing factors that are only in food sources of vitamin C. Vitamin C also has a copper-containing enzyme called tyrosinase. This is what is so important for your adrenal glands to work properly and to protect you from the effects of stress. So vitamin C has bioflavonoids, it's got tyrosinase, it's got an old archaic term called J factors that increases the oxygen carrying capacity of the blood. There's just so much about the vitamin C complex that we don't even know what's in it. And the best strategy is to use food sources of it. So the food sources that Dr. Lee really valued in all of the vitamin C products that you see in the standard process line are buckwheat. That's the primary source of bioflavonoids. Adrenal glandular extract. So every vitamin C product is going to have adrenal extract in it, alfalfa, mushroom. Those are the primary vitamin C sources that he found to be the most effective for protecting your immune system, for protecting your connective tissue, for keeping inflammation down in the body, for supporting your adrenal glands, keeping you protected when you're under a lot of stress. So one of the big quotes that always stuck with me that he said as it relates to vitamin C in the immune system is, he said, the white blood cells are the policemen of the body. Vitamin C is the white blood cells' ammunition, and without it, the white blood cells' enzymes are ineffective against the enemy. So now we know that calcium is essential in phagocytosis, and Dr. Lee knew 50, 60 years ago that vitamin C was essential in phagocytosis. So that's why we say immune system essentials. Those two things are so critical for your white blood cells to go on the attack. So here is a nutritional absolute. There's very few nutritional absolutes, but this is one of them. Every single one of your patients should be on one of the standard process vitamin C supplements. That can be Cataplex C, it could be Cataplex ACP, it could be Ceruta Plus. Even if you're doing a lot of Drenamine, that is a rich source of the vitamin C complex. So any one of those four would count as a really good, solid vitamin C supplement. And there's a lot of vitamin C, by the way, in Drenamine because it's so critical to help your body withstand the effects of stress. So again, that in my practice, that is an absolute. Every single patient is on one of those vitamin C supplements, either Cataplex ACP, Ceruta Plus, Cataplex C, or Drenamine. Cataplex ACP is the most complete, the most economical. It is the most broad effect. It has the most broad clinical effects in the body. It's inflammation management support, it's adrenal support, it's connective tissue support, it's gum support, it's eye support. It has Cataplex A added to Cataplex C and Ceruta Plus. So it's so complete in what it does for the immune system. That extra vitamin A in there protects your sinuses. It supports your mucous membranes in the whole respiratory tract, in your digestive tract, in your urinary tract. So you know if you've seen my seminars, you know I'm a huge fan of Cataplex ACP. That's my favorite vitamin C supplement to get every single patient on. Dosages, I like to do for a really solid dose of vitamin C and bioflavonoids, if you're using Cataplex ACP, 5 tablets twice per day is what I found to be the most effective dose if you want to support the adrenals, you want to support the immune system, you want to support the cardiovascular system. It's a really good dose. If you're using Cataplex C, 3 tablets twice per day would do it. If you're using Ceruta Plus, 3 tablets twice per day would probably be enough with that. But the bottom line is get every single patient on one of the vitamin C supplements. Like I said, there's very few nutritional absolutes. I believe that's one of them. Okay, we're going to come back for one more immune essential nutrient, and then we're going to talk about how to deal with acute immune problems. What nutrition does the immune system need if you're already coming down with a sore throat, cough, sinus infection, anything like that?